Julia joined us really not that long ago, but she's done so much great work since she's been with us at the center. She's a psychologist, and she has trained with really prestigious mentors, people like Kim Muser and David Penn, who've been at the forefront of thinking about psychosocial interventions in first episode psychosis, and also thinking a lot about wellness interventions, particularly around exercise and walking. It was so wonderful to hear the panel emphasize some of that. And she's going to talk with you a little bit about how to get to the gym, and it may help you as well. So without further ado, here's Julia Browne.
Hi, everybody. Thank you for staying for this last talk of the day. That was such a wonderful panel. I'm honored to be in the same room as the three of them. So I am very excited to talk with you all about exercise today. This is a big passion of mine. Before I got into psychology, I was a tennis player, so I am very passionate about this topic. Okay. So my plan today is to briefly start off by summarizing what we know about why exercise is helpful and important. I'm going to talk about what makes it so hard for us to exercise, and particularly focusing on some of the research, why it might be harder for folks who are struggling with mental health challenges to exercise. But I'm not just going to talk about what makes it so hard. I'm going to also talk about some solutions. So hopefully what I can provide here today are some solutions that perhaps might be new and interesting and hopefully helpful. The last thing I'll do is describe a sample program that I was involved in developing in North Carolina, which hopefully will bring some of this to life. So I'm sure we all know in this room that exercise is helpful. Basically, what we know from the research is that exercise has a lot of benefits for our health. We know it helps our physical health, we know it helps our mental health, and it can also improve our quality of life. So in terms of physical health, one thing we know that exercise does is improves what's called cardiorespiratory fitness, or CRF. And this is really your measure of how physically fit somebody is. And what it is a measure of is how well our bodies can take in oxygen and send it to the parts of our body that it needs during exercise. And I'm going to say a little bit more about this in a little bit. We also know that exercise reduces the risk of developing different kinds of medical illnesses and medical problems, like heart disease, high blood pressure, type 2 diabetes. Exercise makes our muscles strong, our bones healthier, and it also can help maintain weight. It can also, when it's combined with nutrition and other dietary changes, can lead to weight loss. Exercise also has been shown to improve mental health. There's been a big literature showing its improvement in mood and related to folks who are struggling with depression. We know that for folks who experience schizophrenia, that exercise can also decrease the distress associated with positive and negative symptoms. It also improves our cognition and our thinking. It can help people's memory and attention. And lastly, there's been some work to show that when people are trying to quit smoking, that exercise can reduce cravings. The third piece here is that in addition to physical and mental health benefits, we know that it can lead to improvements in areas of quality of life. So exercise has been shown to increase satisfaction of our social relationships and our environment, our day-to-day activities. We also know that it can help improve sleep quality. So to bring this final domain to life, I'm going to show a quote. This was from a person who participated in one of our research studies. This was a person who was receiving mental health treatment at a community mental health center, where we got people together and we asked, why do you exercise, and what are the things that help you do that? So this person said, it's nice to go with other people, to meet people. Sometimes when you're dealing with depression and things, you get isolated, so to combine exercise with socialization is really good. And so you can see how this kind of combines some of these different areas and talks about how this actually might improve social relationships and day-to-day activities. So exercise is so important for mental health that there's been research showing that exercise is actually considered an effective and evidence-based treatment for depression. So it also can be combined with antidepressant medications and other treatments we know are helpful for depression. So what some of this work has done is looked at what happens if you take people who are experiencing depressive symptoms and half of them exercise, and you compare them to half of the people who don't exercise. And the people who exercise experience large and significant improvements in depressive symptoms. We know that the largest improvements occur when people are engaged in aerobic exercise, so things like walking, jogging, running. When they're doing moderate intensity exercise, so this is not running as fast as you can, sprinting as fast as you can, but moderate intensity. When exercise is supervised by an exercise professional or some other professional. And lastly, people who are receiving treatment for major depressive disorder appear to experience the largest benefits. So in addition to these important aspects of mental health, I want to come back to this cardiorespiratory fitness, the CRF. So CRF is that measure of how well your body can take in oxygen and supply it where you need it in exercise. And this has been shown to be very strongly linked to how long people live. We know that when CRF is better, people live longer. And in fact, it's so important that the American Heart Association came out with this statement recommending that we consider CRF a vital sign. So just as we all go to the doctor and they take our blood pressure and our heart rate, people are arguing that we should also be measuring CRF because it's so important to longevity and health. An important piece about this, too, is that in order to improve CRF, what research has shown is that actually the most benefits occur when people go from being very unfit or not engaging in much exercise to exercising a little bit more and having a little bit of improvement in CRF. So this is not suggesting that it's people who are already exercising and they're going to go on and exercise even more. It's actually from those lower down categories. So the other important thing that I'm going to show an example of here is that we know that there are programs that can help people improve CRF. So one successful example here was called In Shape. And this trial was led by Dr. Stephen Bartels, who is also at MGH. This was a very large study, recruited 210 people from community mental health organizations. And these participants were receiving treatment for mental health challenges such as schizophrenia, schizoaffective disorder, major depressive disorder, and bipolar disorder. And what this study did was it assigned half the people to receive this In Shape program, which included a membership to a gym and a health promotion coach, which was a coach who would individually help people exercise as well as talk about healthy dietary changes. So that was what half the group got. The other half of the group just got a gym membership and some basic education about what would be healthy in terms of eating and exercise. And what he sought to understand is how many of the people would achieve clinically significant cardiovascular risk reduction. And basically what that means is how many people are going to experience important health changes. And he defined important health changes in two ways. The first was that their CRF would be higher, be better, and that was measured by what's called the 6-minute walk test, which basically means you have people walk for 6 minutes and you see how far they can walk. We know that when CRF is better, people can walk further. The second way he defined this was losing greater than or equal to 5% of someone's body weight. And so if somebody was able to achieve either of those, that's a really important health change. And so I'm going to show you the graph here. So the blue is In Shape, that program that contained both, and the red is just the gym membership. So if you look on the left, after 12 months, just over half of the sample experienced very important health changes, compared to 38%. At 18 months later, the numbers get a little smaller, but you see that In Shape still did better. And so this is an example that not only do we know CRF is important, but we also know there are programs that can actually work and that people can experience these important changes. Okay, so I'm sure a lot of that was review. We've all heard that exercise is really important. So I want to spend the next piece talking about what gets in the way. And, the title of my talk was, Should I Go to the Gym Today? I find myself asking that question every day, including today, and the answer was no today. I did not go to the gym. So what are some of the reasons why? I'm sure if I polled the audience, we could come up with lots of them. But the three main barriers that are talked about kind of cluster in these areas. So motivation, access, and health challenges. So motivation, so things that prevent us or lower our motivation to exercise are often associated with lower mood and depression, feeling stressed out, having some paranoia, not having a lot of energy, and so on, which result in us really not feeling like exercising. The middle piece about access, so I showed this in SHAPE program, which is great, but not everybody has access to a program like that. And there are also things that get in the way of actually getting to the gym. I mean, we do live in Boston, so the weather can be a really big challenge. Also, transportation can get in the way as well. And lastly, there might be limited safe options to exercise if folks are thinking about exercising where they live and it doesn't feel like a safe area to do so. And then the final piece, I think, is really an important one, that if people are not feeling well and they start to exercise and they have a lot of pain, that's not really all that enjoyable. So it lessens people's excitement and willingness to exercise. So I'm going to show two more quotes, again from that same study where we asked folks from community mental health centers, this time we asked them what gets in the way. So these two people, one person said on the left, "That's the really hard part about walking. You have to go somewhere safe to walk, and then you have the extra barrier between you and doing the exercise." This was a person who did not feel that they lived in a safe area to really exercise around that area. And the second one on the right here, "I have a lot of trouble, especially lately, motivating myself to exercise. I struggle with depression. It's one of the hardest things is to get yourself going." So, taken together, there are lots of reasons why people don't exercise as much as maybe they would like. And we can also imagine why folks who are struggling with mental health challenges might not exercise as much as they want to, because there are these obstacles that really do get in the way. So what I'm going to do now is talk about each of these three and provide a potential solution to overcome this barrier. I'm going to draw from different areas of research, from social psychology and other areas, to talk about some potential ways to get through these obstacles. So firstly, to talk about the motivation piece. So there are actually ways that we can design exercise to increase motivation. And one way to do this is to use a prominent theory of motivation, which is called self-determination theory, to design what it is that we're going to set out to do. So in a nutshell, what this theory said is that all human beings have three basic needs. These are the needs here: autonomy, relatedness, and competence. Autonomy means we want to have some choice and control over what we're doing in our lives. Relatedness is about we need to have some sort of connection and belonging. And competence is that we need to have some level of achievement and confidence in what we're doing. And if we as human beings can satisfy these needs, it'll increase our motivation and our satisfaction with our life. So there may be some people in the audience thinking, well, I don't know about that third one or that second one. Of course, there are individual differences, cultural differences, and reasons why, not all three of these might be so useful. But broadly speaking, we as human beings in this room want to have these three needs satisfied. So if we take what we know about this theory and apply it to exercise, here's an example about how we could do that. So you and a friend or you and a family member could exercise together, where you alternate choosing the type of exercise to do for 20 to 30 minutes once a week. The underlined pieces of this example map onto these needs. So exercising together meets that connection, that relatedness need. Choosing the type of exercise you're going to do gets into that autonomy. I'm sure we've had the experience where someone's telling us to do something, whether it's exercise or something else, and maybe we don't want to do that. And so having that choice can improve that autonomy piece. And exercising 20 to 30 minutes once a week is really an achievable kind of exercise, an amount of exercise for someone just getting started, and can promote that experience of competence. There's also experiences, I'm sure, where people have signed up for some sort of exercise program, gone, it is so incredibly hard, can't walk well the next week, and you're less likely to go back. So we want to start off small so that we can experience some level of achievement. So this is one way to get through that motivation piece. So what about this access piece? So there are ways that we can get around this access piece or work on this. And this is a theory from social psychology called implementation intentions, which basically is a problem-solving strategy that uses what's called an if-then plan. And what it is you identify what is the biggest barrier that gets in my way of exercising, and you come up with that barrier, and then immediately you think about what is a solution to get around that. So I'm going to provide 2 examples so that this can be brought to life a little bit. So on the left, someone who has unreliable transportation might say, if I can't get a ride to the gym, then I will go for a walk outside for 20 minutes around the block. On the right, someone who experiences bad weather. So if it's raining outside and I don't feel like walking, then I will go walk indoors at the mall. And so this might seem very, very simple and obvious and straightforward, and that really is the beauty of it. There's been a lot of research looking at how creating if-then plans impact people's ability to exercise and follow through on an intention, and it really does work. The reason people think it works is that oftentimes what happens is we think about the barrier when it happens, and then we just don't do the thing that we were going to do. But if we think about it ahead of time and think about a solution, when the barrier comes up, it's now linked with the solution and we're more likely to do it. So thirdly, health challenges. So exercise can be done in a way that minimizes the risk of making health challenges worse and to make the exercise actually more enjoyable and sustainable. One way to do this is to use what's called stepwise progression, where you start small and increase gradually. So an image you can have in your mind is kind of a hybrid between an escalator and one of those movable walkways. So you'd be on the movable walkway like in the airport, and then you'd go up 1 step on the escalator, and then you'd go straight again, and then you'd go on 1 step. So I'm going to show you an example of what this could look like for someone who does no exercise at all, who's interested in thinking about exercise. So here's what it looks like. In the gray, that doesn't change. Walking for 10 minutes is a good way to start exercise. But what's in blue is the frequency, and that increases over time. So for example, for the first 2 weeks, this person would walk once a week for 10 minutes. Then, weeks 3 and 4, they would increase to twice a week. And then in weeks 5 and 6 would increase to 3 times a week. And the reason this is helpful is because not only are we increasing slowly, but you're actually giving your body a chance to become more fit so that when you take that next step, you're more likely to be able to really do it. So this is in contrast to some other exercise programs, that would say, okay, go run 1 mile on Monday, and then Tuesday you run 2 miles and 3 miles and 4 miles. And oftentimes people don't finish the program because it's just too hard on our bodies. So this is a really effective way to increase exercise in a sustainable manner. So I hope that what that has provided is kind of a basis for understanding not only what are the barriers, but also some potential solutions for overcoming those barriers. So the last part of my talk is I'm going to spend a little time talking about a sample program that will bring about and combine these different solutions. And this was a program that we developed in North Carolina that is still being tested right now. So the program I'm going to describe to you is called Physical Activity Can Enhance Life, or PACE Life. And again, this was done in North Carolina. And PACE Life consists of 4 different components. So the first piece is that it consists of walking groups. These groups are held twice a week outdoors in the surrounding area of the community mental health centers in North Carolina. The second part are independent or home walks, and these are varied from no times per week to 3 times per week. And these are done at a location of people's choice, a time of their choice, and a duration of their choice. The third piece includes activity tracking, or Fitbits. So people are given Fitbit watches that track steps, heart rate, and exercise minutes, and they wear them during all waking hours. And the final piece contains goal setting, or if-then plans. So people set a step goal, so a goal for how many steps they want to walk on a given day in the next week, and how many walks they're going to do on their own. And we have these goal setting sessions once a week, and they're done in a group setting. So the reason I'm bringing up this program is not just to describe this program to you all, but because this was really designed and developed to address the 3 barriers that I mentioned earlier. And so this program was designed to address motivation, access, and health issues. And so the way it was addressing motivation is it is based in self-determination theory, which I'll describe more in detail in a minute. In terms of access, this is a walking program. We're recommending walking as the mode of exercise. We know that walking is an effective way to increase exercise and experience health benefits. It is obviously the most accessible form of exercise as well. We also included if-then plans, so that if barrier, then solution, to address problem solving and access issues that do come up. And thirdly, it addresses health challenges. Everybody gets a physical exam before starting, and it also uses stepwise progression. So I'm going to show you a little bit about, the next slide is about how we think this actually addresses these barriers, and kind of our conceptual model for how we think this is working. So in the blue, all the way to the left, are those 4 components that I just described. So Pace Life has walking groups, home walks, goal setting, and using a Fitbit. And we think that these parts map on to those basic needs that all people have. So walking groups, these were groups that consisted of about 8 to 10 people, 2 leaders, where you're walking for half an hour and you're socializing and interacting while you're exercising. That meets the relatedness need, that experience of connection and belonging. Independent or home walks are done at a location of people's choice, whatever time of day they want, whatever intensity they want. Gets into that autonomy piece where people have a choice about what they want to be doing. And these last 2 pieces, goal setting and if-then plans and activity tracking, map onto that need of competence. So being able to set your own goals and then use a Fitbit device to actually track whether you're meeting those goals can promote the sense of achievement and competence and confidence. And we believe that if we can satisfy those needs, that will then lead, over here to the green, to increasing motivation. When people feel more motivated, they will exercise more, and ultimately our goal is to improve cardiorespiratory fitness, or CRF, to help people live longer and healthier lives. So this, in a nutshell, is what we think, why those different components are there. The other piece of Pace Life is that it uses stepwise progression that I mentioned earlier. So this is a snapshot of 18 weeks of the program. So again, in gray is the piece that doesn't change over the course. Twice a week are walking groups, and that was done for primarily limiting the amount of transportation that people may need. In blue is the number of home walks, so walks that people are going to do on their own. The first 6 weeks we say, really, you don't have to think about doing many home walks. Let's start just twice a week together. Week 7 through 12, we ask people to do 1 home walk a week, and then increases to 2 home walks a week. And the orange is how intense the walking and exercise is. And this was measured through heart rate. We would recommend people exercise in certain heart rate zones depending on their own resting heart rate and other factors. So the first 6 weeks are low intensity, then they increase to low to moderate intensity, and ultimately lead up to full-on moderate intensity exercise. And so the reason we were doing this is so that we would be able to encourage people who were not exercising at all, engage in a program that could help to sustain exercise over time. So far, Pace Life has been tested in 2 small studies. So the reason why we do these small studies is really to assess 2 different things. The first is whether people will do the program and what they think about the program. So before doing a big study and seeing, what are really the benefits, kind of first saying, would anybody actually sign up for this and participate in, and what do they say? So the first study was 10 weeks long and had 16 participants. The second study was 24 weeks long and 17 participants. And all the participants in these studies were receiving treatment for a schizophrenia spectrum disorder at community mental health centers in North Carolina. So preliminary results from the 10-week study, our group attendance rate for walking groups was 65%, which actually is quite high for exercise research. We were not paying anybody to come. They were not getting anything except walking in a group with me and some other people. People really liked wearing a Fitbit. They wore it on 81% of the days that were part of the study. We also asked people to rate satisfaction. So the highest score people could give was a 32, and the average was a 28, suggesting that people felt pretty satisfied. These results are now being analyzed for the longer study, and initial results are showing that there was quite a big improvement in CRF in that small study. But again, because this is a very small initial study, we're most interested in these kinds of outcomes. Did people come? What did they say about it? But based on some of these initial findings, the next step is to run a larger study. And this larger study is going to be starting in January in North Carolina, where we're going to really start to understand whether Pace Life is helping people to exercise more and experience important health changes. The way we're going to do this is we're going to assign half the people to get Pace Life, and the other half of the people are just going to be given a Fitbit. So we're going to see if our intervention can beat out just buying a Fitbit, and hopefully we will be able to learn something important from that. So my final takeaway for everybody in this room, I want to share what the new physical activity guidelines say. And this came out just last year in 2018, and these are the guidelines for exercise for adults. And what this says is adults should move more and sit less throughout the day. Some physical activity is better than none. Adults who sit less and do any amount of moderate to vigorous physical activity gain some health benefits. This was a huge change from the past iteration of the guidelines, where there were very specific amounts of exercise that were recommended at certain intensities. And what this is showing is what we know now from the research, that really everybody who is able to stand can do this. They can sit more and they can move less. And I hope that that is something that I have been able to convey today, that this is achievable for all people and that can result in really important and meaningful changes in our lives. So with that, I want to just thank you all for staying for this final talk and listening to me. I thank the organizers of the events and acknowledge the people who are involved in the Pace Life project and the funders of that. Thank you all so much.